cancer is mostly not genetic. So if they do these studies called the population attributable risk, so they say, if somebody develops cancer, what percentage is due to this? So smoking was the biggest thing, which is about 35% of population attributable risk. Diet's actually about 30%. So obesity has turned out to be a very important risk factor. So the World Health Organization describes a number of cancers as obesity-associated cancers. The thing is that those are the two biggest. If you look at genetic factors for cancer, it's probably in the order of 2 to 5% attributable risk. So yes, there is a risk. Certainly genetics does play a role, but if you look at the overall cancer, like overall everything, the biggest risks are really smoking, diet, and then you have viruses too, like cervical cancer, human papilloma virus, hepatitis B is, can cause cancer, Epstein-Barr virus. So there's a number of environmental issues, between physical carcinogens like smoking, diet related, particularly obesity and type 2 diabetes, and then environment in terms of viral and other infectious diseases.
Don't hesitate to pass on the knowledge and hit the subscribe button on our channel for more practical health insights.